Hello, everyone, and welcome to Move Daily Talks. I'm your host, Tracy Steen, and today I'm welcoming my friend and pelvic floor physiotherapist, Corrine Wade, to the podcast. Corrine is the owner and CEO of Care Physiotherapy, which is the only clinic in Kelowna that purely specializes in pelvic floor conditions for all genders. Corrine has 30 years experience and has a reputation as being the leading authority in pelvic physiotherapy in the Okanagan. I've invited Corrine to come to the membership and to speak in many of our challenges, and I can tell you that she is a wealth of information in this area. She's worked as a physiotherapist in a myriad of healthcare settings in both the States and Canada, and she frequently does community lectures and podcasts on many topics, including pelvic pain, male and female incontinence, core strengthening, injuries related to pregnancy, and male and female sexual dysfunction. She is especially passionate about women's health and breaking the taboos and myths around pelvic health and sexual health. Well, we're excited to have Corrine here. Let's welcome her to the podcast. So I'm here with Corrine Wade of Care Physiotherapy and really excited to have you back, Corrine. You have been a wealth of information when you visited before. So welcome to the podcast today.
Thank you.
You know, pelvic floor health, it's so nice that it's becoming more talked about. It almost seems like it's kind of one of those topics that might be taboo for some people, especially as we get into the sexual health component of it. But it shouldn't be. It's normal. We all have it. It's a part of who we are. So why are we so ashamed or afraid to talk about it?
I know. I think it's a lot of that cultural stuff, right?
Yeah.
Like when I was a teenager, and I'm
Yeah.
sure you too, that like my mom never talked to me about periods, let alone sex. That was like never discussed. So I compare that to my daughter who's 18 and her friends talk about periods and they've got their app and they're tracking stuff. So it's
Yeah.
just, yeah, there's less. I love for that generation that they maybe because of social media too, that they can investigate stuff, but I like that there's more communication. I mean, I know we still have work to do, but I think it's our generation and generations before that maybe we're told, oh, don't talk about that, or that's inappropriate, or don't touch yourself down there. That's where we get all this shame, about not showing our body parts or touching them. Whereas I think for boys and men, that was different. They're allowed to go pee behind a tree, right?
Right.
They're allowed to like explore their little boy parts in the bathtub
Right.
when a little, right? That they're not, you know, I've seen parents do it. They're like pulling the hand away from a little girl in the bathtub saying, "Oh, don't touch that. That's inappropriate." Whereas the boy can,
Yeah.
so I think that's where it started, right?
Right.
Like
Yeah.
culture,
Yeah.
religion, whatever. But now it's good. We're making our own way and creating a new clean slate, right?
Yes, definitely making strides in that conversation. I totally remember. I can't even tell you where I heard this, but one of the things that is in my brain about masturbation for sure was that it would make you grow hair on your palms if you did.
Isn't that
Where
crazy?
did that come from? I don't know. That's
Crazy.
hilarious. But
All those
anyway, but
myths, right?
and that also it was very sinful. Like it was, you shouldn't do that, right? So there's a lot that sort of came at us as young people, and
Yeah.
so we developed these beliefs. And if they weren't challenged by those around us or by educating ourselves, then that's what you teach your children.
Yeah. And again, and it depends where you live, right? Like Canada versus Europe versus, let's say, US. And depending what state you live in the US, you get a totally different education at school and sex ed. And then I've talked to people that grew up in Europe, and the Europeans have a very, obviously, I mean, you were just in Europe, right? Very much more open-minded, even in cultures where they're using saunas together, like in Sweden or whatever. Like
Yeah.
it's not shameful to even show your body. So again, I think that's for, but even now I have clients that women will say, "Oh, I've never looked down there. Even if I'm in the shower having a bath, I use a washcloth over top my skin. I've never touched my own vulva. I've never touched my own labia." And so then for me as a pelvic physio to try to educate them on let's say their muscles down there, or let's say if they're doing a class with you online and you're trying to get them to activate their core, but they're kind of disengaged from that part of their body, they're not going to be able to get as good of a workout because there's a part of their brain that's like la 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 la. So even though it was way back when that was happening, it's still to a certain extent happening now.
Yeah.
Yeah.
Yeah. And I think that's a good conversation to have, that it's really important to know how it all works down there as well, right? Because
Yes.
I actually had this client once, and it always made me laugh, a little bit of giggle. And but she would be doing a lunge, and then she would touch herself in the front and in the behind. And it was just her and I, so it didn't matter to
Yeah.
me, but she would touch herself in both spots, and then she would go into the lunge. And I think what she was doing is really trying to ensure that her core was
I was like,
activated, that, she wasn't doing a posterior or anterior pelvic tilt, but everything was like in that bucket, nice and straight, and trying to activate those core muscles to ensure that she was doing it properly. So why is that so important?
yeah. Well, it's interesting. So, like, obviously, if a client like that was working with me, I might start them with their hands on their body, figuring out where they are in space, right? And get, but then obviously eventually I'd be like, okay, we need you to know where you are in space without having to touch yourself, right?
Right.
It would be
Yeah. We're
it'd
not
be
in the
bringing
public
it
gym
down.
just kind of going, excuse me, I just got to know what's going on right
I
here.
don't know what's going on. But it's interesting. So I tell patients, imagine, let's say if I was working with someone's wrist or elbow and they had an injury and they were a baseball player. And maybe they had a cast on and they took the cast off. So it makes sense to us in our culture that like an elbow or a wrist injury, it's going to take some time for them to know where their wrist and elbow is in space as they're like throwing the ball and getting more power. They have to learn that again after an injury. So that's no different than the pelvic floor when it's been through like birth trauma, or if I had patients that have had surgery, maybe they had a hysterectomy, a C-section, or cancer surgery. So again, that's where I might have a client actually have to hold their hand on their like bony pelvis or on their muscles just to know where they are in space. You're right, to activate their core and pelvic floor. But then eventually, just like the baseball player, I'd be like, okay, you need to know where your body is in space without looking at your hand because it's kind of hard to throw a ball, right? So again, pelvis is no different. That's what I tell my patients, no different than any other body part. It's just the pelvic floor, you can't see it because it's kind of deep inside your body. So like if those are the bones of the pelvis for anyone watching YouTube, we have our bones, but then the whole undercarriage is all muscle, but
Right.
you can't see it because it's covered up with skin. So that's where people can get a little bit like, oh, I don't know how to use that part of my body. And that's where a pelvic floor physio might help someone like get re-educated with that, right?
Yeah. And so what would be some of the starting things that we would begin to work on in order to get familiar with those muscles in the pelvic floor?
Good question. So I always tell people it kind of depends um, what they're experiencing in their pelvis, right? Um, so let's say if I said the top three things or three or four things that I tend to see clients for are undercarriage, to make it simple, is kind of poo, pee, sex, and
Yeah.
core strength, right? So fecal control, bladder control, sexual function, but also the muscles holding up the organs and our spine. So if I'm working with someone, let's say if they have pain, kind of what I might be telling them to connect with those pelvic floor muscles might actually be having to learn how to let them go. Because again, if I have a painful elbow because I'm a baseball player, I'm going to be protecting it and I'm not going to be able to throw my ball,
Yeah.
right? So if someone's in pain, that might look different versus let's say if someone has weakness after having a baby, right? So if that's a kind of a weakness thing, we always say the pelvic floor works with the diaphragm. So a super easy thing that anyone can do is actually being very aware of their breath.
Right.
So just like if you're coaching clients with doing the boot camp classes, if they're not breathing, they're going to have a really hard time even activating their abs and controlling pressure, right? So our pelvic floor is constantly controlling pressure. I tell my patients it's like a hydraulic on a mountain bike. If
Okay.
the pelvic floor and the diaphragm can't move together, then it's like a mountain bike that's not controlling pressure when you jump off a jump. So I always say, hey, we don't want to be a hardtail mountain bike. that's clenched at the bottom and the top of your core muscles, because then things are going to hurt. Imagine if I jumped off a mountain bike, jump with a hardtail mountain bike, it's really going to hurt my back or something. But if I jump with a nice, suspension mountain bike, I won't even feel the shock. So the pelvic floor is always controlling pressure, whether we're laughing, coughing, sneezing, jumping, right? It's really the pelvic floor that stops us from leaking by controlling that pressure. But then it's also holding and supporting so our organs don't descend and feel like they're falling out.
Right.
Yeah. So I think that's one of the myths, is that tight equals strong in any muscle, right? We've been taught, like Jane Fonda told us, right?
Yeah.
I remember doing Jane
Push it
Fonda
in.
with my mom, right? Suck
Yeah.
your abs in, grip your bum all day, grip your vagina, right?
Right.
So it's kind of like if I had my jaw tight all day, if I said, hey, Tracy, how about you go clench your jaw all day? It's going to make it so strong.
Yeah.
You go, that's the dumbest thing I've ever heard, right? But we did that in the 80s, right? We were clenching everything to make it strong, but now, with research, that's not how the core works. It's not grip it all day, and it's not grip it throughout the whole workout, right? So I think you and I have talked about that a little bit before, that let's say if someone's even just doing a bridge, even their butt muscles are going to turn on and tighten to lift their bum off the mat or ground. And then when they bring their butt back down, it has to relax. And that's the only way to strengthen a muscle, right? Is letting it relax, tighten, and it has to go through its full range of motion, right?
Right.
So you can kind of get it for an arm or a leg muscle because you can see the arm and leg moving, but the pelvic floor for a lot of my clients, unless I make them put their hand on their crotch, right? Even from the outside, I can cue them and say, hey, we need to feel your pelvic floor rise and fall appropriately for whatever you're doing. And then we can put it into Tracy's workout plan in the class, right?
Yeah.
That would be one of the main myths. Tight is not strong. Tight is just tight, and tight causes pain and dysfunction and can actually make us weaker, because now that muscle has no time to rest.
Right.
Right. So
Yeah. There was
right.
this thought that, yeah, you're standing doing your dishes and everything should be cinched for the entire time. Like just engage the core so that you can practice. I would do that lots. And then when I heard you speak about that, it's so interesting how much I just engage my core throughout my day. And there are times that I think it's good and appropriate. I'm bending down to pick something up. I want to make sure that I do that. But just when I'm sitting or standing, it's not necessary. That's what I'm hearing you say.
Yeah. And I love, there's a well-known physio in the US named Anthony Lowe, and he
Mhm.
has a great thing that he tells his clients. He says, tension to task. So let's say even if Tracy's picking up a coffee cup, right? The amount of tension her arm uses, her brain knows, oh, I only need a little bit of tension to pick up that coffee cup. You didn't have to think, oh, I wonder how much my biceps and my forearm needs to da, 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 da. Your brain knows exactly how much tension for that coffee cup, versus if I threw a kettlebell at you and
Right.
so you had to grab that 50-pound kettlebell, again, your muscles would get ready for that task and create more tension.
Right.
So that's what we do as pelvic floor physios, is we teach clients how to get those pelvic floor muscles automatically working so that they could do one of Tracy's workouts and not even have to think about it. So, right, if Tracy's got people jumping up and down doing jumping jacks or skipping, every time your feet hit the ground, that's kind of the body going, oh, there's going to be some impact. Let's get ready. But that would be very different than if I was sleeping, right, or watching TV. There's not a lot of tension required for that task. So again, I wouldn't need to clench my jaw. I wouldn't need to clench my bum. Da, 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 da. But you're right. That was a fallacy back kind of in the 80s. And I still see clients doing it now. They're like, oh, someone told me I better grip my core as I walk my dog around the block.
Mm.
And I'll say, well, tension to task. Do you think we really need that much pelvic floor tension to walk your
A chihuahua.
dog, right? Probably
Maybe if
not.
it's a bull mastiff, maybe a little
Exactly.
bit different. But yeah, exactly.
Yeah.
Yeah. Okay, that's a really good tip. I think that we don't think about that too often. So if I wanted to strengthen my pelvic floor muscles then to ensure that they're activating during exercise, what would be some exercises that I could do regularly? Or you let us know, how frequently do we want to be training those muscles to ensure that they're ready for us?
Good question. So it kind of depends. Again, I'd say breath is the first thing. Because again, subconsciously, so let's say before we get injured or before we have problems with our pelvic floor, if you watch children running around, they're not having to go, "Ooh, I better activate my pelvic floor as I jump off this log or as I'm jumping on the trampoline with my friends." They're
It
not
just
conscious.
does it
It just
automatically.
automatically does it, right? So I tell my patients, when you wake up in the morning, your neck muscles automatically stabilize your neck, right? You don't have to wake up and go, "Ooh, just a sec, I better co-contract my neck as before I get up off this, pillow." So something to start with, though, if there's dysfunction, if there's pain, maybe there was incontinence, maybe someone just had a surgery. So again, depends what it is. Breath
Yeah.
for sure. So it could be before a workout, doing a few mindful, 5 to 10 deep breaths with your hands on your rib cage, noticing the opening and closing of the rib cage. So when we inhale and our rib cage expands and opens, our pelvic floor too kind of expands and creates space. And as we exhale, that's usually when we exhale is when we activate the core, right? Like if you're doing a bicep curl or karate, if you're punching something, you're going to exhale with that punch. So
Right.
the exhale would be when the pelvic floor would activate. So first off, we'd just be doing some deep breaths to connect to the diaphragm and the breath. And if that feels okay, then again, if no one's looking and you're just at home, maybe if you're not aware of your pelvic floor, you could have your pants on and put your hand on your perineum or on the crotch part of your underwear and just notice, oh, when I exhale, can I feel a little bit of a gentle rising, or the idea of almost like picking up a blueberry or a little bit of tension, pulling my perineum off the chair. And then as I inhale, it should just subtly feel that my pelvic floor lets go, or my sit bones kind of feel like, right? So again, it's very subtle. We don't, there's one physio I know, she says, don't act like you're picking up a piano, right? You're not trying to pick up a surfboard or something like that.
Yeah.
That girl on social media that shows herself picking up surfboards with her vagina.
That's
Don't do that.
right. You don't need to do that. A
It's not
blueberry is plenty.
a blueberry's plenty. Yeah. And it's just that gentle picking it up as you exhale and then inhale, letting go. So if you said, well, how many should I do? That's more just kind of in the beginning to find the muscle. So
Yeah.
let's say if you just had a baby 2 weeks ago and you're like, oh, I had damage down there and I'm kind of disconnected from my pelvic floor. We might just start in an easy position, like lying down or lying on your side and connecting to those muscles. And then bit by bit, we might over time add some gravity and do it in sitting and then standing. And then eventually I'd be like, okay, you're subconsciously doing it. Now do it in Tracy's class. So like it would be a
Yeah.
progression, just like my baseball guy. If I took his cast off, I'm not going to get him doing kettlebell swings the first
Sure.
day,
Yeah.
right? I might start with range of motion and make sure he da 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 da. So again, same way that we'd start with any other injury. But again, I think those myths out there would be tight is not strong, like tight does not equal strong, right?
Right.
And the other
Yeah.
myth is like that Kegels are the only thing that makes our pelvic floor strong. And that's
Right.
a huge myth. So most pelvic floor physios are like, they get upset if, and me too, we get upset if people think all we're doing all day is just teaching Kegels.
Right. Yeah.
Because that
You're
is
like,
such a
that's one
small,
element that we
such a
use
small,
sometimes. Yeah. It's
yeah.
such a small.
Again, it would be like if someone had a knee injury, and as a physio, if I was only working on vastus lateralis, but I wasn't looking at your like hamstrings, or I wasn't
Yeah.
looking at vastus
Yeah.
medialis, like that'd be
Right.
silly, right?
Tibialis. Yeah,
Yeah.
exactly.
Yeah. So it's more about us looking at muscles on the outside of the pelvis too. So even the hip rotators and the glutes actually activate, they can really be kind of muscles that give us a lot more pelvic floor power, especially there's one hip rotator, it's kind of hard to see in here, but if
Okay.
I'm palpating a patient vaginally, there's a hip rotator called obturator internus that I can actually touch vaginally. Now, if that muscle isn't functioning properly, again, maybe it's tight or sore, has been injured because it blends in with the pelvic floor. It can actually be more of a hip muscle problem causing incontinence. So I have
Really?
to kind of be a detective, right? And figure
Yeah.
out what are the biggest culprits, right? Or I've had clients where they had an old ankle sprain. So someone might come to me and they're like, oh, Corrine, I'm leaking when I'm running. And I'm like, okay. So I always do a full assessment, and other physios too. We always assess a whole bunch of muscles on the outside. We look at your movement pattern, what joints are in alignment or not. And then I've had clients where their pelvic floor only on one side of their pelvis might be quite protective or holding tension because of an old injury down the chain, maybe at the knee or the ankle. And the brain is smart, right? It's like,
Yeah.
oh, we need to protect that side of the body, and
Yeah.
it'll keep doing
Compensate. Yeah.
it'll do it for decades.
Yeah.
So seeing a pelvic floor physio might like look like you're going to a sports physio, right? Because I'm always looking at people's feet, how they activate the core muscles in the feet, because that works with the pelvic floor, like foot, leg, hip, boom, pelvic floor. So so it can be hard for people to figure out on their own at home, right? If people are struggling at home and they're like, darn, I've kind of tried to do this kind of Kegel or that kind of thing, and I'm struggling, then that would be a good time to reach out to like whatever country you live in or wherever you are, to maybe connect with someone who specializes in pelvic therapy to kind of go, am I on the right track? And sometimes it might only take one or two visits, right? Just to make sure, again, my baseball player, let's say he's trying to throw a baseball, but he's, I don't know, throwing it like this with his shoulder up around his ear. He might
Yeah.
go, how come I have no power? And so the physio would be like, well, your shoulder's getting in the way, or you've got the wrong posture.
Yeah.
It can,
Yeah.
it can be simple things like that. Just what posture are you using as you try to engage? How are you breathing? Or are you like bearing down? Right. So
Yeah.
I'll test people vaginally and I'm like, show me you gently picking up a blueberry, and they'll bear down and push my finger out.
Wow.
Like they try
Yeah.
and have a bowel movement. And they might not know it. They're like, oh, I've always done Kegels this way. And I'll say, okay, we need to focus on the Kegel feeling like it's lifting, not you feeling like you're pushing your undercarriage away from you, because that could cause increased prolapse, could cause hemorrhoids, right?
Okay.
That's pressure against the anus. Or I've
Right.
had people that have hernias because of
Like
maybe,
in their bowels.
well, it could, well, actually more like a hernia, even out the front of the abdominal wall, like
Yeah.
an inguinal
Okay.
hernia or a belly button. So if someone is
Right.
using an incorrect strategy for lifting, they might end up with like a prolapse bladder or prolapse uterus and get a hernia out the front.
Yeah.
So I tell people it's kind of like our core abdominal area is like a tube of toothpaste, kind of. If you squish it too much at the top, so again, that's maybe someone holding their breath all day because Jane Fonda told them to do that or something. And if they're holding a lot of pressure at the top near their rib cage, the pressure has nowhere to go but down.
Yeah.
That person might say, oh, whenever I go to my CrossFit class, oh, I have an aching or a pressure in my vagina, or it feels very heavy in my undercarriage.
Yeah.
So that person might just have an incorrect strategy of how they're exercising, and we can help them navigate that. And then maybe they won't even get prolapse. So
Right.
prolapse is quite common. And I don't want to create fear in people, because in the research, they say up to 50% of women, 50% have
Yes.
some degree of prolapse.
Okay.
They
And
might not know it.
can you describe prolapse for the listeners?
Yeah. So essentially, prolapse is when our organs are either sagging or dropping down lower than maybe where they were when you were like 12 or 16 or 18 years old, where they were before you had maybe children. Or maybe I've had women though with prolapse that have never had a child, but maybe they had a very physical career as a mail carrier, or maybe they worked in an orchard, like in the Okanagan, we have lots of fruit trees. I have lots of women where they're like, oh, I was carrying like huge pails of cherries my whole life. So
Yeah.
let's say if every time they picked up that bucket of cherries and they held their breath because they were just trying to work as hard as they could, over time, that cumulative, repetitive down, 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 pushing the pressure down can weaken the pelvic floor, but it can actually make the bladder, the uterus, and even the rectum sit in a position that they shouldn't be in, lower than where they should be.
So is that
Sometimes
sorry, is that a surgical fix then? Or there are things that we can do, some of these
it,
exercises that we're talking about to increase the strength in that so that the organs don't droop
exactly.
low? Yeah.
And there's different degrees of prolapse.
Okay.
So a minor prolapse is like actually probably doesn't cause, like in the research they say like us, so there's 4 stages. So a stage 1 or a 2 is quite minor. And it's more, in the research they say it's more the degree of bother that the person has.
And
So
what would the
most,
bother feel like? What,
good
just
question.
that pressure?
Yeah, so they might go for a walk and go, oh, after the walk, I felt heavy. I felt like
Right.
there was a golf ball kind of sitting at my vagina or something. So a mild prolapse, visibly, they might not see anything at the opening of the vagina because it's mild. But if a greater degree of prolapse, like a stage 3, so a stage 3 is where the organs start to kind of sit at the opening. So if I was looking at a female's perineum or at their vagina, I could actually see some tissue at the opening. And a stage 4 might be when it's actually exiting. But there are lots of things we can do. I've had a lot of women with stage 3. We're just getting better strategies of how do I breathe? How do I engage my core? Sometimes it's adding, if they're menopausal, maybe they need a little bit of extra vaginal estrogen to plump up the collagen.
Right.
But usually it's a multifactorial thing, right? I'm also asking them, are you constipated? So actually just good bowel health can prevent a huge amount of
Oh,
pressure.
yes.
And we always look at the whole person, right? Are
Right.
they straining? Are they following your recommendations of good fiber, adequate fiber
Right.
and water? What's their posture on the toilet, right?
Right.
Like
You're a fan of the potty.
squatty
What's it
potty.
called? The squatty potty. Yes. I still don't have one of those. I need to go on Amazon and buy that because
Yeah,
yes, I have used one before. My daughter's roommates had one. She probably hates that I just said that,
that's okay. No, healthy.
but yeah, it's good for, and why is that so important to have that
Well, good.
posture on the
So
toilet?
imagine, like in countries where we're not sitting at a 90-degree angle on a toilet. So anatomically, we're meant to more do number 1 and number 2 in the forest, like a cave woman or caveman
Right.
squatting.
Right.
So if our knees are a little bit higher than our hips, that's a more optimal position to help the pelvic floor just effortlessly let go. And that's why for birth, I always joke with my patients, a lot of the labor positions we use in labor are kind of like what you use to have a bowel
Yeah.
movement,
Bowel
is that
movement. Yeah.
deep squat, right? And how am I breathing as I'm having that bowel movement, right? So prolapse, again, it can kind of be different organs. So kind of the short version would be all of our organs are very intimately, closely connected in the body. So this would be the bladder, and here's the vaginal canal, and then here's the rectum. So what can happen over time is it's not that the bladder falls right out your vagina. It can't, because they're in 2 different, I say, lanes of traffic.
Right.
Bladder cannot fall out your vagina because it's in a whole separate like area. But the bladder can push into the front wall of the vagina. And let's say if that vaginal wall is a bit lax because we've had babies, or maybe we're menopausal and now there's not nice collagen. If we're not on estrogen or we don't have enough estrogen, the collagen in that vaginal wall might not have as good support. So now the bladder is kind of collapsing into the vaginal wall. And what you'd see if you looked at your perineum is actually more the vaginal wall turning itself inside out. So when patients panic, and I don't want to freak people out because I've had patients go to the ER and they're like, "Oh, I saw something coming out of my vagina. I thought it was a cancerous tumor,"
Oh, yeah. Of
which
course.
is so disconcerting. But
Sure.
it can look like extra pink tissue, kind of like, again, if my lip turned inside out,
Yeah.
it's going to come like, yeah. So physio wise, there's lots we can do to, take a stage 3 prolapse and move it up to a stage 2.
Yeah.
But throughout the day, it can vary. You can wake up in the morning and just like our boobs, right? In the morning, maybe they're a little more perky because gravity hasn't had an effect. In the morning, I have lots of patients that go, I have no pressure. I'm fine.
Right. By the end of the day, they're like dying.
The day they're tired, right? So
Yeah.
this is where exercise is important. All those postural muscles on the outside of the body. So not just the pelvic floor, right? But how we breathe, how we poo. Are we moving our body daily, like you tell people, right? Or are we kind of sedentary and not using our postural muscles? So again, we always look at each person uniquely, right? But there's tons we can do. It's not always about surgery. And there's So if we're on the subject of pessary, of prolapse, pessaries are a tool that kind of, there's different shapes, but they kind of, some of them kind of look like a diaphragm that you would get, one would get fitted for that by their obstetrician, or some physios do it. And what that can do is create lovely support for the organs. Let's say
Okay.
if you're going to do a boot camp, you might put the pessary in, do the boot camp, and you're good to go. Or I have some
Okay.
patients that wear it all the time. There's other pessaries that kind of, there's even one that people can buy that they don't need a doctor's order for. This is called the Uresta.
And she's just showing it for those who are listening. She's just showing the little uresta.
Yeah, it's a little device that you insert vaginally. It's a Canadian device, actually, and it has a little ridge on it that actually in the vagina, that ridge gently pushes up against the urethra, just creates like a little pressure to help keep that urethra closed. So what that means is, let's say if someone's like, oh, I don't do Tracy's jumping jacks because they make me leak. And if that's something someone can try, and they can order it online. So Uresta is spelled Uresta, but I can give Tracy the
Sure.
link. So that's something anyone can use. Or let's say if they say, oh, I have a lot of vaginal pressure or heaviness when I go hiking with my friends, or I'm going to hike the West Coast Trail. If this is something that helps support the bladder and it stops women from leaking, that's the main reason it's marketed. You put this in, and for a lot of women, they're like, oh my God, I'm not leaking. So we would
Right.
always want people strengthening their pelvic floor to, help with this. But this is a great device so that women, I have lots of women, they're like, oh, now I might not need to have bladder surgery.
Yeah.
It's for minor support. So the
Okay.
main theme is surgery is not the only option.
Sure.
There's always things we can do conservatively first. And I always tell people to try that first before,
Yeah,
you know,
for sure. Yeah. No, that's good advice. Let's talk about I'm in menopause. I know a lot of our listeners are have crossed that bridge and are in menopause as well. So there's so much debate about hormone therapy. It's almost a painful space to be listening to at times because it's so volatile. People on both sides have opinions. And, I think it's great that everyone's having this conversation. Um, but it's just so individualized that when people speak up, it's their own experience, which means we have millions of experiences and opinions about if we should do it or not. I would love to know, though, just what sort of impact and changes are you seeing in menopause when it comes to that hormone fluctuation? We're losing estrogen. So, what is happening down
down
below because of that?
there. Yeah, it's significant. So again, if I say the main things the pelvic floor does
Hmm.
is in that poo, pee, sex, core stability category. So
Yeah.
let's say for fecal control, I definitely have women, maybe menopausal or as they go through that transition, let's say previously when they were just fine and they were in their 20s and 30s and let's say they weren't working out, and maybe they weren't caring about how strong their glutes were. So imagine here's the anal sphincter, here's our glute max. So let's say if patients are like, you know what, I can't be on hormones, I don't want to, that's not something I even want to think about. We always say, hey, well, let's maximize the strength of your pelvic floor around that anal sphincter or around the urethra. And just like we hear about menopause, let's keep that muscle bulk in the muscles on the outside that help the body, but also the pelvic floor. So the hormone changes that unfortunately happen, number one, the pelvic floor muscles have a lot of estrogen receptors.
Okay. Yeah.
Yeah. The downside is anything that has a lot of estrogen receptors is gonna have, there's gonna be some change, right?
Yeah.
So what we could do prior to menopause, right? As best we can, strengthen those muscles so we have good bulk going into menopause. The
Yeah, I
good
love
news,
this is the
yeah,
preventative stuff. This is where in perimenopause we're fixing the roof while the sun is shining, right? We're
exactly,
we're doing the work. Yeah.
right?
And I think people just don't consider that as being as crucial as it is because they feel fine today.
I
But
know.
it's going to make such a big difference if you can actually build up the bulk, like you just said earlier
Yeah,
on. Yeah, I like
yeah.
that. Good tip.
And even, my baseball player analogy, having the proprioception
Yeah.
and the awareness of even knowing where the heck your pelvic floor is. because it's way harder for me to teach someone in their 90s if they've never really gone to a fitness class, or maybe they're just not really aware of that part of their body. It'll take me a lot longer for them to teach them how to breathe, get them aware of their rib cage. How do you move your pelvis, right? Versus someone who's stayed active, they've been playing pickleball, they've been hiking, da, 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 and then they're like, oh, I'm starting to notice a few things, and they get on it. It's just like any injury. The sooner you get on it, your body's going to be able to make the changes faster. So again, muscle bulk around the urethra and the anus, we want to maintain that, right? And then for intercourse, we're going to lose lubrication,
Right.
unfortunately, with menopause. So again, let's say if someone's like, you know what, I can't do the hormones, I don't want to, it's not even something I want to discuss, then we can look at good quality sexual lubricant that does not have like sugar and parabens and phthalates and some
Yeah.
candy flavored whatever. And then they're going to get like a yeast infection. So I
Yeah.
always say
Yeah.
good quality, like organic lube, or I love, I have it here somewhere. I
Yeah.
bought
Do you
this.
have some
I
recommendations
have,
for our audience? That'd be great.
well, I love Uber Lube.
Uber. Okay.
Uber Lube, and I can send you the link. So what's nice about Uber Lube is it's just silicone and vitamin E.
Okay.
What's nice about Uber Lube, especially for the menopausal population or even for anal sex, right? I always say to women, sexual lube needs to be super slippery and stay on the surface. You don't want your lube absorbing into your tissues, because then it's not going to be slippery anymore. So if I have women saying, oh, I love coconut oil, I'm like, well, how often are you having to reapply it? Because if you have dry menopausal tissue, your body might be like
Right. Just absorb that. Yeah,
taking it up,
sure.
and then you got to keep reapplying it. Whereas something like silicone is going to stay on the surface. So that would be for sexual activity. But then maybe at night before you go to bed, you could use a vaginal moisturizer. And that would be something, again, like what we would put on our skin at night for our face. That's to plump up the tissues, hydrate them, and keep those cells happy so that they're less likely to have discomfort, but also to tear. So,
Right.
so that's with hormonal changes. Unfortunately, we don't have as much collagen at the opening. So again, as best we can, like making sure those tissues can stay, lubricated and healthy and well hydrated. Those are things we can do if we don't want to go down the hormone path, right? In saying that, though, the vaginal estrogen in the research, so again, just only estrogen here, not for the whole body, just topically, again, in the research is like so, so good at helping all those problems, because the other thing that happens when we start having less estrogen in this urethral area, the bladder has estrogen receptors, as does the urethra. So we get a significant increase of UTIs.
Yeah. I've heard that that is very common in menopause.
Yeah, because the acidity, when we're in our 20s and 30s, our body is so smart. It makes this so acidic that bacteria can't grow. So E. coli has a really hard time growing when the acidity is perfect. But unfortunately, post-menopause, we don't have that. So then the bacteria can proliferate, go up the urethra, and then cause problems, and also urgency frequency. So we do see more incontinence, more urgency frequency when we don't have estrogen, right? But again, in saying that, if someone's like, nope, no, thank you, I don't want the estrogen, then definitely seeing a pelvic floor physio, or just getting on that earlier in your life. And again, good healthy diet, because
Yeah.
sometimes the urgency frequency that I see women with is because they're drinking 5 cups of coffee before 7 a.m. And I'm like, wow.
Right. That's going to do it. That is going to
Again,
do
it's
it.
looking at the whole picture.
Hey, going back to that vaginal cream, is that something that you put on your labia or is that going right in the vagina? And what
Good
kind of cream
question.
is that to keep it
Good
lubricated?
question. So a
Yeah.
really good resource for any of this information would be like Dr. Kelly Casperson,
Yeah.
a urologist in the
Yeah.
US, and she has excellent information as well. Dr. Rachel Rubin is a urologist in the US, and they have gone into the research and really looking at the safety. So again, low dose topical estrogen that you would, so let's say, here's your bladder, here's the vaginal canal. And I love Kelly Casperson. She always says, these two are like condo roommates. They share a wall. So all their the only thing that separates your bladder and the inside of your vagina is the wall of the vagina. So very thin. So putting estrogen cream, or it could be a tablet, like Vagifem is a tablet. There's rings, there's all sorts of different ways. But essentially you want it to go up the vagina so that the estrogen goes to the bladder and the urethra. Because inside the bladder, there's estrogen receptors. So when the bladder is starving for estrogen, it makes the bladder quite overactive and kind of like upset. And it makes us get that, oh, I have to go to the bathroom. So
Right.
estrogen can calm the bladder down, but also help the health of the urethra and not let those bacteria get up there and wreak havoc. So again, Dr. Rachel Rubin, Dr. Kelly Casperson, what they say they're really trying to advocate for is if an elderly woman has urgency frequency at 2 a.m. and she's getting up to run to the bathroom and she slips on the mat in her bathroom, falls, breaks her hip. Now she's in the hospital.
Right.
And we all know the risk of once you're in that hospital bed and you
Yeah.
get pneumonia, the chances of
Yeah.
you coming out are not great.
Yeah.
So
And
there
it
is
all could have been prevented if you didn't have the urgency to go, which
exactly,
if you had
again,
taken care of that, right?
it's kind of each person is unique, right? Everyone has
Yeah.
their own history. So again, I'm not a doctor,
Yeah.
but again, that's kind of the framework we're looking at. If
Yeah.
now, if we're living into like, we could easily live to 90 or more.
Yeah, sure.
Menopausal women, there's a huge chunk of our life. Let's say 40 years of our life could be after menopause. That's a lot of decades,
Sure.
right? And so it's really hard for those tissues to stay healthy for like 3 or 4 decades, even if we're doing all the right things, if the estrogen's not there, right? Yeah.
Do you know if, okay, so say you want to keep that lubricated down there. Do you know what I know about HRT or menopause hormone therapy is that you want to take estrogen with progesterone to protect the uterus. But say you're not going on HRT, say that that's something that you decided not to do, but you still want this lubrication in the vagina.
Yeah.
Is it something that you can just use this cream for, or is that the same estrogen that estradiol or the estrogen to replace our lost? Do you know what I'm saying?
Good
Like,
question.
is it
Yes.
is
And
it
there are
separate
two.
estrogen, or is this the hormone therapy that we're talking about that should be combined with progesterone?
Good point. So two totally different. I
Okay,
mean,
that's
like
what I
I think
thought.
there's definitely lots of women that choose not to have systemic whole body hormone therapy. And so here's a good
Okay,
example. Let's say if someone says, "Oh, I grew up in the era of the women's health initiative
initiative. Yeah,
trial,"
sure.
and so let's say if I'm 80 and I was like, darn, I missed the window on like when I should have started hormones back when I started menopause
Right,
systemically. So let's say if I'm 80 years old and I'm like, oh, well, maybe for me it's not appropriate to go full body. At any time, it would be appropriate to just have estrogen vaginally, low dose. It's such a low dose that it doesn't affect the rest of the body, but it could prevent me as an 80-year-old from getting a UTI.
right.
I think in the research, I think it reduces your risk by 68%. So they said, Kelly Casperson says that low dose, and again, it's only twice a week. So
Okay,
there's a loading dose for every day for 2 weeks. And then once the tissues are loaded and they're plumped up, only twice a week, until the day you die, is what Dr. Rubin
right.
said.
Okay.
Um, and so that could prevent that lady from, again, having a hip fracture or going
Yeah,
down, right? Yeah.
yeah.
Or just traveling. I have so many women in their 80s and 90s, and they're like, oh, now I want to travel, but oh, I can't, in Europe, like if you were just in Europe, to find a bathroom, unless you go and get a cup of coffee or water. So some
Yeah.
people have such, right?
No bathroom for
To
you,
find
exactly.
bathrooms. Right? So let's say if someone has urgency frequency or they're on the airplane and they're like, oh, I have to pee so often. Oh, I'm just not going to go. Or I'm leaking so badly.
Yeah,
Now I don't have the confidence to travel. That's
sure.
heartbreaking.
Yeah,
So
for
let's say
sure.
if they could get help with pelvic physio or maybe the uresta or whatever it is, whatever
Yeah,
helps,
yeah.
it gives them back their quality of life, right? So again, I'm not saying that everybody has to put estrogen up their vagina, but it's just knowing. I think there's a lot of misinformation out there where women are like, oh, well, I've always had urgency frequency. I've always had to get up 5 times a night to pee, which is awful. So you shouldn't have to get up 5 times a night. Like
No,
once to twice is normal. Anytime more than that, you're not getting deep restorative sleep.
no,
You
yeah,
know, all the sleep research, right? I have so many women, if I can just get their pelvic floor working so they can sleep through the night, oh my God, then they have
yeah,
less anxiety,
yeah,
they feel better.
that's
So again,
right.
we always look at what's the root cause. Why are we not sleeping? Is it the bladder getting you up, right? Or why are we running to the bathroom? Is it the 5 cups of coffee before 7 a.m., right? So again, we always look at
The whole picture.
like my intake form when people come to see me, they're like, oh my God, why are you asking me all this? I'm like, because sometimes it's a quick fix, like, right? I'm
Yeah,
like, just, I'm going to help you poo better. Okay. And then that's it. Might be one treatment. And I'm like, now you're pooing better. And now you don't have prolapse symptoms. So again, some people have symptoms where they think it's a thing. I do have women where they're like, I am sure I have prolapse. And it turns out just that their pelvic floor is tight. And that can feel like pressure. Like if I'm squeezing my fists really hard right now, my fists, as I'm squeezing them, they have a lot of pressure. So
sure.
sometimes it's a simple fix, sometimes not. But definitely if people have pain, so again, that could be pain with sex, could be tailbone pain, pubic bone pain, pain in their sacroiliac joint. So again, any sort of pain anywhere around the pelvis, there could be a component of the pelvic floor and other muscles. So we don't want men or women suffering in pain. And again, it's kind of like if you are leaking more than find is good for your quality of life, then yeah. So again, we always talk about longevity. If, like Dr. Peter Attia says, if you look forward towards retirement, what do you want to be doing?
Sure.
And if you're like, I want to travel, I want to play pickleball, then it's like, well, let's make sure you're not leaking all over the place
Yeah.
every time you hit the pickleball, right?
Yeah. Yeah. Yeah, I love that approach of just really assessing the whole person too. I love that you do that because, and I think we should just do that with so many things because I was just talking to my friend the other day. So often we just want a pill to fix what is wrong, but unless we sort of see exactly what's causing that pain or that disorder or that uncomfortable feeling, it's we can give a pill, but it doesn't fix the problem. It just puts a
No.
band-aid on the solution at times. And
Yeah.
so just looking at the whole body, at the whole person, I think, and just doing that really good intake is so important. So good for you and your clinic for doing that. I love that.
And I'd say any pelvic physio I know, and even regular physios at a sports clinic or a hand clinic, or like
Yeah,
it's what we learn, and other professionals too, massage therapists, chiros, right? We learn to kind of not just, again, my baseball player guy, I would not like just look at his elbow. I'd be like, yeah, show me how you're standing. Show me, right?
sure.
Like we would look at the whole person. So the pelvis is no different, right?
Yeah,
Yeah.
right.
Yeah.
Yeah. So many good tips here today. So, such a good conversation with you, Corrine. Thanks so much for coming on and talking about that with us. If people
Welcome.
want to work with you, I know they have to be in Canada mostly, but
Yes.
where can they find you? How can they work with you and your clinic?
Good question. So they have to be in British Columbia, Canada,
Yeah,
unfortunately. So even if I work with someone virtually, my licensure only covers British Columbia. But anywhere, like if anyone's wondering, they can always DM me. But let's say if someone is in the US, then the American Physical Therapy Association lists physios by category of women's health, and then same in British Columbia, all across Canada, even in Britain. So wherever you live, that there would be a listing of like pelvic floor
yeah,
physios, right?
yeah,
And then the sexual dysfunction too is something pelvic physios. I always want to throw that in there because a lot of women, menopausal women, they'll go either it's pain or they're like, oh, it's meh, like my orgasm went away. So again, just to make sure women know that too, we need that blood flow and we need that pelvic floor strength to actually have like pleasure in the bedroom too. So again, I just mentioned that because again, we don't just want a pill thrown at somebody
sure.
if there's a bigger thing going on. Yeah. But if anyone
Yeah.
has any questions on Instagram, they can DM me or I can
Yes.
point people in the right direction if they're struggling.
And your
Yeah.
Instagram handle is,
Care Physio with a K. So
yes,
KarePhysio. Yeah.
perfect. I will link that here and in the show notes as well. Well,
Thank you.
thanks for listening, everyone. Corrine, thanks so much for being my guest today. As always, go move daily, everyone, in your fitness, wellness, nutrition, and pelvic floor health. And we'll see you all in the next Move Daily Talks.